the link between air pollution and inequalities event. If everybody could please type your name and organisation in the chat, just so we know who's joined us. And also you might be able to reach out to other people, and other people might see where you're from and so on. Please put yourself on mute. If you don't, Sophie will put everybody on mute. So it'd be really good. Sometimes you could just hear background noise. Most of the time you can, but there's always an odd occasion. Please be aware we will be recording the session, and if you don't want to be recorded, then turn your camera off. Although it is so much nicer seeing people's faces on camera. It's quite difficult if everybody turns their camera off, because then you just don't know what the impact is. But you do have the option. There will be an opportunity to ask lots of questions. I know Anita got in there before everybody else, but we've saved quite a bit of time right at the end of the session, so feel free to ask questions then. It would be great if we can just, let the session be presented as it is. Again, in this session, we will provide an introduction to air pollution, what the national approach is to air quality, and how we're leading the way in Bradford. And I've been told I have to say District and Craven, so it's Bradford District and Craven. We will also cover how air pollution is linked to reducing inequalities, as well as sharing examples of work happening in the district. There'll also be time for Q&A session, which I've already said. We're joined by Sally. Sally, do you want to give us a wave? From Bradford Council, and myself, of course. I started yabbering on without introducing myself. I'm Hawarun Hussain. I work for NHS England, and I am a net zero programme manager for North Eastern Yorkshire. My geographical patch is West Yorkshire at the moment. I wanted to say before I hand over to the first speaker, I am the first speaker. So how are we doing for numbers? Yeah, and I can't see the chat, so I'm assuming everybody's putting in lots of
yes, everyone's putting in their name, where they've joined us from. We've got about 37 people joining us, but people will come in enough. So looking forward to hearing your presentation.
Right, so I'm just going to share my screen. I'm not going to do a present an MS Team mode, because sometimes my laptop throws a wobbler and I really don't want it to today. So I'm going to share my screen. If anybody does put their hand up, like, is it Kelsey? You've got your hand up? Or is it Bridget, Kelsey? Sorry, it's really difficult to tell. And you're on mute, so I can't hear you.
I don't know how to put my name in.
Okay, not to worry. I'll make a note of you. Is it Bridget or is it Kelsey? Which is your first name?
Bridget, yeah.
Hi, Bridget. We'll make a note of it, but thank you for mentioning that. I'll start on presenting. I'm going to be really quick. I'm not going to talk on all of my slides because I've got 5 minutes, and the slides are there more for information. So when you get the slide deck at the end of the show, at the end of the session, you'll have access to the information. So first thing first, public health. Of course, a lot of you would have had the Health Inequalities Alliance email. That's how you found out about it. For Public Health England, put a cost to air quality and the impact it has on public health, and the different elements of it. And that came up to £1.69 billion. That's a lot of money. And that's not just for Bradford, that's for the whole country, because it's Public Health England. The NHS fleet, so we as healthcare, with my NHS hat on, our fleet is, there's about 20,000 vehicles, and we see a direct link between what NHS does, that's just, and the impact it has to health. And a lot of you would have known that NHS declared a climate emergency in 2020. And agreed and accepted the fact that what we do has an impact on population health. And then the Centre for Cities Research, that's about a few years back, 7-8 years ago, they published a document, and it says something like 1 in 20 deaths up north is attributed to air pollution. So if you're looking at this picture and thinking, where the heck did that picture come from? Of course, a lot of you would have seen it, but this is, I took this image from the Chief Medical Officer's Annual Report 2022. That was dedicated solely to air pollution and the impact it has on health. And it showed that actually air pollution impacts on us from, pregnancy, i.e. before your child is born, or before we a child is born right up to, old age. And of course, it disproportionately impacts on people with comorbidities or with other health issues. And for everybody from NHS who's thinking, but everything's changing now, we don't know what we're doing. Actually, the 10-year plan, which was published last autumn, had two things that had directly impacted on the work that I do. One of them was a whole paragraph in a document with 160 odd pages. There was a whole paragraph talking about sustainability, net zero, and the green agenda. But there was a whole page on air pollution, page 67. I'll put a hyperlink on the slide deck. So if you want to read it, there is a whole page on air pollution. That's the difference. That's how important we feel air pollution is in the NHS. And then if you're thinking, but that's not my job. These are lots of the Royal Colleges, and I took that slide from one of my other colleagues who pulled it together, and that's not all the organisation. Every Royal College, every leading healthcare organisation, pressure group, anybody has declared a climate emergency, and has identified how important it is that we do something, and we do something proactively. I feel like I'm jumping up a bit. So the next bit is engaging the workforce. Again, I've put a hyperlink onto the documents. It's the young people, the people who are coming into healthcare and health and social care generally are really, really concerned about the impact of climate change, the impact of air pollution, and want to make a positive difference. Again, if you want to, feel free to, when you get the slide deck, go into the hyperlinks, they're all live. And then I just want to, have I got time, Sophie? How am I doing for time? I'll just talk through the next slide.
We're all good.
Okay, so the Health and Social Care Act made it mandatory for all health and social care staff to work on climate change and net zero, or do something. Every organisation, every trust and ICB across the country has a green plan. So if you are working for a trust or an ICB or a GP practice, I'll explain the GP practice bit. You are all, as organisation, as NHS, we're all signed up to do sustainability and net zero. GP practices, you are signed up by default through the ICB Green Plan, because everybody has to take, every person who's commissioned, every supplier where we buy from has to sign to say they will do either produce a green plan or a carbon reduction plan, something to reduce their carbon emission in line with the NHS organisational agreement of 2040. It comes up in the Care Quality Commission. So if you have a CQC assessment, it will be on there, and it comes up on the NHS standard contract. So if you're a supplier to NHS or a commission service, it's on the NHS standard contract. I'm going to just one quick last slide. I've managed to sneak that in because I really wanted to give the hyperlinks to all the different research papers that have been produced as part of the Bradford Clean Air Zone and its impact, its positive impact on the health of the population. My name is Huwaran Hussain. If you need anything or if you need to contact me, please do contact me. My email addresses will be on the slide deck as well. I'm going to stop sharing now and let Sophie, I think you're going to play a video clip.
I certainly am. Let me just stop spotlighting yourself. Thank you, Huwaran. And we'll get the video up.
I feel like I've gone really fast, but I always speak fast when I think I have to be careful.
Oh, good.
Or people are paying attention to what I'm saying.
My name's John Knight. I'm the Director of Research at the Bradford Institute for Health Research. So 50 years ago, we thought that smoking wasn't bad for your health. And important research from doctors and researchers found just how fatal it was. And everybody knows now that smoking kills us. And we're in a similar position here with air quality and the toxins that come out of our tailpipes in the cars that we drive. The difference is that the toxins, the gases, the pollutants that come out of our tailpipes when we drive our cars are invisible, so it's very hard to understand how they can be causing harm. But over the last 5–10 years, doctors and researchers again have been showing how harmful these poisons are. And in Bradford, we've been at the centre of some of this research. Our Born in Bradford study has shown just how damaging it is for children, causing asthma, maybe about 1/4 of asthma cases in children due to air pollution from our cars, causing growth retardation, shrinking the growth of babies in pregnant mothers. So this is nasty stuff, and we need to try and do something about it. So the clean air zone is one of the most effective methods of cleaning our air. We know from studies around the world that it really does work. It stops people polluting the air that we breathe, and particularly in inner city areas and children and families most at risk. Clean air zone is one of the most effective ways of getting cleaner air, particularly from reducing the harm of our dirtier vehicles travelling through the city. And the people most at risk are the people in the inner city, people with the poorest health at the moment anyway. And we know some people are against it, but we also know from surveys that we've been doing in Bradford that over 70% of people are in favour of the clean air zone.
Thanks, Sophie. And I mean, that was produced about, I don't know, 7–8 years ago by John Wright, one of our leading research colleagues, as part of BHAR, Bradford Institute of Health Research. Sally, do you want to go next? And the hyperlink's still on the docket, on the slide deck, so if people want to use it in the future or want to watch it again, there it is.
Can you guys see this okay?
Yes.
Yes, you might want to put it into presentation mode, Sally, but yeah, all good.
Let's see, how would I do that?
If you just go to slideshow at the top bar. Yeah, all that.
Is that better for everyone?
Yeah, perfect, thank you.
Okay, so yeah, that was a great way of getting Born in Bradford to join us with the video there from John, and his colleague Rosie as well has worked with us really closely at the council. That video was done before we put the clean air zone in place, so I'm able to talk to you a bit more about some of the exciting findings that have actually come out as we've looked at data after the zone's been put in. So yeah, we're one of the places in the UK that's lucky enough from an air quality perspective to have a clean air zone. We know that not only will it bring air quality within the legal limits and benefit health, it's also a great way to deal with some of the impacts of climate change as well. And we know that having the cleaner vehicles on the road really reduces the amount of carbon dioxide from transport in the city. So that's another good byproduct of what we've been doing. So why did we need to have a clean air zone? We've been reporting data from the council on air quality to the government since the 90s, and we've known for a long time that we're exceeding the legal limits. The time came for those legal limits to be put in place, I think around 2010. Those targets were missed, and it was obvious that pollution wasn't going to come down like the government had expected it to. They've modelled it and said this problem is going to sort itself out. Our monitoring data was showing that wasn't happening. You can see from this modelling on the right there, the modelling that we had done of the city corrected using our own monitoring data. Anything in red is exceeding the legal limit. So we didn't just have a little tiny isolated problem in Bradford like there is in some other places. We'd got a city-wide issue that we needed to deal with. And for problems like that, really one of the only ways that you can deal with it is actually tackling the traffic that's there. You can't just get them to move to a different road or drive through more quickly through one point. It needed a whole wide city intervention. So the government came to us and directed the council. The Secretary of State served a notice on the council to put in place what we call a Class C charging clean air zone. I'll explain that to you in a little bit more detail in a minute. If we just look down at the graphic on the left there, you can see the shape of the clean air zone and all the, I think it's lower super output areas that you guys in the NHS will recognise. And what we can see there is the darker greens where we get the biggest change in air pollution. And what was really nice was that corresponded with the areas where we've got the highest deprivation. So the biggest changes in air pollution were in the areas with the greatest need in terms of deprivation and health already. And you can also see that the improvements extend out beyond the zone itself. It's not just a change within the clean air zone. Because it's such a big clean air zone, the traffic that's coming towards it will naturally be heading a lot of it into central Bradford, and the fleet needs to be cleaner to get in and avoid a charge. So the improvements are much more widespread than the zone itself. So we get improvements across a lot of the district. So how does a clean air zone work? I won't bore you with all of the detail, but just to say that allowing councils to put in clean air zones was actually put in place back in the year 2000 within a provision within the Transport Act that the government made at the time to allow us to deal with these kind of local issues. The whole cost of the zone and putting it in place has all been paid for by government, and also the support programme that went alongside it that helped people make the transition. We've got 330 automatic number plate recognition cameras, and they're on the outside of the zone and also inside the zone itself. And obviously we've got thousands of signage, which you probably noticed out when you're out and about in the district. All the data from those cameras is actually sent to the DVLA. It's not dealt with directly at the council. It's dealt with at the central service that deals with all clean air zones, and our data goes off to them and they identify which vehicles are non-compliant. They take the charges as well at the central service, and they marry the two, and they check for non-compliant vehicles, did they pay a charge? If they did, all well and good. If they didn't, that data then gets sent back to the council to deal with. So we know that we were talking about commercial vehicles only. That's vans, lorries, coaches, buses and taxis. It's not private vehicles. And we're only looking at the older ones of those. So it's vehicles that are older than sort of 2015, 2016. At the time the Clean Air Zone was put in place, that was only around 4% of traffic. But those vehicles are so very dirty. They produce a disproportionate amount of pollution, and we knew that dealing with them would make a huge difference for us in terms of air quality. We've got a national and local whitelist. These allow exemptions. There's things like some emergency vehicles, fire engines and what have you are exempt. But also we have our own local whitelist where we've allowed exemptions to residents and some small businesses as well. The thing to say about clean air zones is that we don't want people to come in. We don't want them to pay charges and bring their dirty vehicles in. The best effective clean air zone doesn't take any charges at all. It keeps those dirty vehicles out. But allowing people to pay a charge does allow that bit of flexibility where people need to come in and they can't avoid it. But for most people, the charges are set such that it is actually worth changing your vehicle rather than coming into the city daily. The other thing to say about the charges is that the money that's taken for the clean air zone is all legally ring-fenced for dealing with the problem itself, the problem of air pollution. So it has been, we've been in the news a lot. Controversial is a word that's used. I feel it's not been as controversial as some other places. I think Bradford's done really well to get across that health message. I think the fact that we've got Born in Bradford and a lot of health research already going on means that I think our population understand better than others that actually we were doing this to improve public health. So I don't think we've had the same problems that some other cities have had. But that said, we have been in the news quite a bit, and there's just some examples there. It's been quite high profile for the council. Obviously, we've done our own publicity as well. We've been really keen to let people know that there's a clean air zone coming in the run up to the zone. And we've also been keen to go out with information about the zone and the improvements that we've seen as a result of it. It has to be said that there's only so much a local authority can do to get the message out. Really, this would have needed actually a national campaign. As these clean air zones came into place up and down the country, it should have been something that was on TV and put out by the government, and perhaps Public Health England as was at the time, to help people know, because we know there's still a lot of people driving unwittingly into the zone and ending up with charges that wouldn't have happened otherwise. They may have been able to make other plans. So that's a shame. But we did our very best to get the message out, but we have to accept that we can only go so far as a local authority. I did mention earlier that there's a huge packet of support that's gone out from the council. We've distributed almost 32 million in funding to help people upgrade their vehicles and get ready for the zone. As I mentioned also, we've allowed exemptions. We've allowed one exemption for all residents in the district, and also SME businesses have been able to have 3 exemptions. People have been allowed access to grants as well, and it has to be said that quite a lot of people have taken the option to upgrade their vehicle rather than keep an exemption for an old vehicle, and that's been really nice to see, because we get that improvement in air quality there. I won't read out all those different grant amounts, but you'll be able to see, looking at that, we've put an awful lot of money into our taxi fleet. I think it's the biggest proportion of money that's gone out. The taxi fleet in Bradford were I think it's fair to say a little bit upset when this first came in as an idea, but they've been brilliant. They've risen to the challenge, and we've now got, I think it's 99.87% of taxis in Bradford are compliant with the clean air zone. We've got the cleanest taxi fleet in the country. They've been also going for electric grants as well. We've got 800 new electric taxis out there. All petrol hybrids, and they've been absolutely brilliant. And the nice thing is, when we talk to drivers, they're saving money as well, because these vehicles cost less to run and less to maintain, and they're really pleased with them. So that's been a really nice success story. Just on the exemptions there, you might be thinking, well, if you're going to make everybody exempt, what's the point in having a clean air zone? What we have in Bradford is a lot of traffic that comes through the city that isn't from Bradford. 85% of the older commercial vehicles weren't registered in Bradford, and we knew that before the zone launched. So we knew we had that bit of headroom to make things easier for people that live here and give them more options. They've got the grant or the exemption, and I think that's made it a lot easier for the people of Bradford to be able to handle having a clean air zone in place. Another thing that other cities, I think Bath and Bristol, really warned us about this, was that quite often there can be, and it does turn out, a misconception that clean air zones cause displacement and people just drive round them. I think you can see with the size of ours in Bradford that if you come into Bradford, you couldn't really avoid the zone itself, and that if you were driving round it, kind of where would you actually be going? But we felt that we really had to address this issue thoroughly. So we put out 20 odd cameras before the zone launched, just after it launched, and then a couple of months later, when things had settled down, on routes that we thought could possibly be displacement routes. And we worked with highways really closely on this. That data was analysed, and what we saw was that after the zone had been launched, that actually there was most sites a very slight reduction in commercial vehicles. We weren't seeing any increases in commercial vehicles. We know the sporadic problems in some of the little villages where there might be like a development site or a muck shift or something going on, and we will get commercial vehicles from time to time using little roads. But we know that they're usually compliant vehicles and not anything to do with the clean air zone whenever we've investigated those kind of complaints. And this study also showed us that across the board, we weren't seeing increases on other routes. The team that I work in, we do a huge monitoring programme. I think some of our colleagues are on the call that go out day in, day out, changing nitrogen dioxide tubes, calibrating our stations, and keeping this huge monitoring network alive and running it. The data feeds straight into health research. It's really valuable as part of seeing as the changes happen, marrying that up with health data and seeing the changes that we might see on the ground. But it's also really important for us to report back to government, who are watching this clean air zone as closely as we are. All the data goes to them month by month, and they have staff in the science team at DEFRA looking at this data month in, month out. We also have a statutory duty as a council to report on air quality, and we're keeping in line with all their statutory reporting, as well as the extra data that they want, because we're a clean air zone. You may have seen some of this kit out on the street, but we've got quite a lot of expensive kit to run out there. So I just come back to the charges a little bit more, because it is something that does tend to interest people. The revenue from the clean air zone, you can see here that we've taken, this is a couple of months ago now, so it's probably changed slightly, but we've taken around 10 million in CAS charges, that's where somebody pays to go in advance, and around 16 million in PCNs, that's penalty charge notices, and that's people who've driven in, not paid, and then been charged extra because they didn't pay a charge. And that's unfortunate, and I think a lot of that is communication, and I do think a national campaign could have helped us with that. I think that those people would have rather paid a much smaller amount for a charge or been able to make other arrangements. You can see there the charges we charge for different vehicles, and they're pretty much in line with what's going on in other clean air zones in the country. So what are we doing with some of that money? One of the first things that members wanted us to do in Bradford was to set up a clean air schools programme, and because really they wanted it to be very noticeable that this is about kids and improving health. So the first thing we did was we put out a huge grant programme. I think, yeah, a £500 grant programme for schools. The leaflet on the side there shows you some of the different things that we were funding schools to do. That went down really well. That money was taken up gladly by schools, and they've put some great initiatives in place that we've been monitoring. New bike sheds, new paths into schools, walking buses, all sorts of different initiatives, and it's been a great programme. Alongside that, we've run an engagement programme going into schools. I think there's a couple of thousand children now had sessions from our amazing engagement officer, Shafia. She's been going out into schools, teaching them about the impact of air pollution. And also she works with environmental wardens across all the 5 areas of Bradford, dealing with anti-idling. We weren't dealing with private traffic as part of this zone. One of the things communities were saying to us was, particularly around schools, we're getting a lot of people parking up waiting for kids, running their engines. The kids are walking out into this dirty environment. It's just crazy. What can we do about it? We've got wardens out there now with banners, educational leaflets, and the backup of being able to find people and informing people that this is actually an offence to be idling on the public highway. So that's been a really good thing that we can do working with schools that's funded by the Clean Air Zone. We're also looking at carbon dioxide emissions and how global warming, and you'll be glad to know, Aaron, we're picking up on other emissions as well as a result of the Clean Air Zone. And the council's doing a lot of work. I'm not sure if you're all aware, but we've recently in December adopted a climate action plan, which I'll provide a link to that later, but that looks at how we deal with climate change. We've put out a lot of money for taxis, like I mentioned, and we've also done some electric truck trials with some local hauliers as well, looking at how they can save money by running electric trucks, which are not completely clean because you've still got particles from the tyres and brake wear, but a lot cleaner from the tailpipes and definitely improvement. So, is air quality improving? Yes, it is. And we're really pleased to say that since the zone's launch, we've seen a really nice, steady downward trend. As I was mentioning for anyone on the call earlier, weather is a huge factor. So because weather varies, so does pollution reading. And it's the blue line on this chart that you can see that's heading down nicely from left to right. That's all over the place. That is our air quality readings. And we know that last summer we got the lowest readings we've ever had in Bradford. You can see the green line at the top is the amount of traffic that we've got going on, which is now just slightly higher than it was during COVID. So we're getting reducing pollution as traffic's rising. Most other cities, as far as we're aware, look to be kind of flatlining. They're not seeing the same reductions that we are in these cities that have put clean air zones in. And that's hardly surprising because they've got a lot of older vehicles passing through their cities than we have. So health, which is the point of this. So hopefully we all understand how the zone works and what we're doing. So what did we do? We worked really closely with Born in Bradford, who'd got funding from the National Institute of Health Research. We looked at all data from everybody in the district before the zone launched, as the zone launched, and then afterwards. And that's the basic premise of how we've looked at has health improved or not. We know that we really wanted to deal with some of the inequalities that exist in the city. Isha on the left here lives only 10 miles away from Alice, who lives in Ilkley on the right. Isha in Manningham was facing, the statistics are that she'd got 10 years left healthy life. to be expected, and that's not fair. That needs dealing with, and we know that air pollution contributes to this. It's a passive intervention that we can change for people without them having to have any behaviour change or anything more complicated, just making the air cleaner where they live. And it's the right thing to do, we felt. The good news is that we found that since the zone launched, we've seen some really interesting reductions in respiratory and cardiovascular health. These have been checked. Obviously, Born in Bradford know what they're doing. They're much cleverer people than we are, but we understand that they've done this alongside other conditions that aren't affected by air pollution and been able to see these really big reductions for primary care appointments for respiratory and cardiovascular health. Those numbers there are 598 less appointments per month for respiratory, 134 less appointments for cardiovascular. So the latest news on this, and this isn't a very good slide because I've only just put it together, but we got some data just before Christmas, which made my Christmas, where we actually valued the health benefit of that across the city. And that study found that in the first 22 months of the Clean Air Zone being live, the societal benefit of that health improvement was 108, had a value of £180 million to Bradford. So that just vastly outweighs all the cost of doing this. And just, I can imagine that when back in the past, when they brought in smoke control areas and they stopped burning coal and they brought in gas fires, there will have been a huge health benefit to that, but nobody measured it. Now in Bradford, working together, we've collaboratively been able to work out what difference it's made in the city. Things that just would have gone unnoticed, benefits to doing difficult things that don't get measured. Other cities haven't been able to do this. I think London's done a study, but all the other clean air zones aren't able to share this kind of health data. So we've been really proud. We've had it out on the streets. We've put billboards up, and we've gone on the radio and the news to make sure that everybody in the city hears the good results. So there's a bit more, there's loads more information around this, the work that the Clean Air Zone's supporting, and I can go into that with anybody else who's a bit more interested, but I'm aware that we've got a lot of other things to talk about and questions, so I will hand back to Sophie and let you all, I'll stop sharing and let you all ask some questions now if you like.
Thank you, Sally. Yes, we did want to leave quite a big chunk of time for questions at the end, because it usually feels like on these sessions that you just never have enough time to answer everything. So however you'd like to ask them is fine. You can either put your hand up and Sally and Harren will do their best to answer, or put them in the chat. Emma has just posted in there that, can you share the York CHE paper methodology? I don't know if there's a link for that, Sally.
Yeah,
if it's on the slide, they'll be going up.
Yeah.
Okay, great. And then we've got one from Helen. This is from the chat, and then we'll go to Emma. Helen said, is there any support for school minibuses / paying for the Clean Air Zone, please?
Is that the grant support that there was minibus grants available? You would have to check online, and the pages are on the last slide that Hawaren put on, just to check what grants are available at the moment. There was grants for minibuses for schools, and there's also exemptions available as well for them.
Thanks, Sally. Emma, would you like to go ahead?
Thank you. Sally, is there anything that you can say about any next steps? And like, is there going to be any changes to, for example, you know, as engines are getting cleaner, is there an expectation that the oldest age of a vehicle increases? Does that make sense? So like you said, sort of vehicles pre 2015, 16, like, are we in the next year or two going to see changes come in for vehicles that are older than 2020 or something like that, or any other kind of changes that may be coming? Or is it a case of actually it's done what it's supposed to be doing, we're just going to keep going for the next few years, and hopefully the charges will reduce in line with people just naturally getting rid of their older cars?
That is a great question, Emma. This issue is controlled by central government. The Clean Air Zone had to be set up in accordance with what they've got, the Clean Air Zone framework. As far as I'm aware, they, like you say, it's a case of job done, legal limit met. I don't know that there's any ambition to tighten those limits, but that would be the obvious next step, wouldn't it? That would be the obvious right thing to do, to tighten up to the next Euro standard. Whether or not there's any appetite for that at government, I haven't seen anything. And I know that things are winding down somewhat with the government's response, the Joint Air Quality Unit. So they know that they're heading now to a situation where more of these clean air zones will have met the legal limit. What they do at that point is remove the ministerial direction on those local authorities, which allows them, the agency, to keep in or remove their clean air zone in their area. So it would then be a local decision rather than a national one. Hi, Duncan.
Hiya. Thanks, Sally. That was brilliant, that presentation. Really enjoyed it. You might not have the answer to this yet, but I just wondered with the research, like the initial health impacts in terms of improving health seem really positive for Bradford. I just wondered, going back to Hawaran's first slide, which was that CMO slide about how air pollution can affect children and, you know, going right through life course. Are Born in Bradford looking at that as well, about the sort of differential aspects by age? Because one of the things that we've got to deal with is an aging society. So there's obviously there's going to be a bigger proportion of vulnerable people, and just because people are getting older, you know, and I just wondered whether they're really addressing that as well. And I was thinking particularly at either ends of the age spectrum, you know, with like young children and older people.
My understanding is that they are, Duncan. So that data there that you saw on the slide was the early findings. So it's actually, and I mean, we did push for that from the council, because we were like, Rosie, we can't wait 5 years to have some data out of this. We need something quick. So that data was done. I think it took a couple of years to get out after launch, but it was great. It's just the early findings. They're doing a much more detailed, in-depth study as we speak, and my understanding is that finishes this summer. It also looks at the economics of the zone and the 180 million data there that affect. It's being done by the same centre at York. So they're looking at the economics of it all, and that will feed in there too. I think it's really important that they look at age profile, deprivation and health inequalities as well. And I know that's part of their remit in the NIHR project to look at that. I think my colleague Liz and I are linking up with Faith, who's doing the data for BIB, and we'll find out a little bit more in the next couple of weeks exactly what they're looking at. I'll let you know.
Thank you, Duncan. Thanks, Sally. A question's come in the chat from Paul, and then we'll go to Salah as well. Paul has said, is there any appetite plans for a similar clean air zone schemes being introduced to the whole of West Yorkshire, so Calderdale, Kirklees, Wakefield and Leeds?
So I think I'm not sure if you're aware, Paul, but Leeds were actually in the throes of being directed to put in a clean air zone. They during COVID saw a reduction in air pollution, surprise, surprise, and then didn't put in a zone. So I don't see them sort of changing the mind and going back on that now. Although, you know, there could be a change in the future, I'm not sure. I think they would need to be part of a government programme where they would get access to all the government support and everything to do that. And I think once you've been directed and not put in a zone, I wouldn't have thought they could go back on that decision. The other local authorities don't quite have the same high levels of air pollution that we did in Bradford at the time, and that's why they weren't singled out by government in the way we were to put in a zone. There is no reason why local authorities couldn't do this for themselves based on congestion and pollution if they chose to do so. But having access to the government support does make it a lot less difficult. I think it's fair to say.
Do you want to come in there, Hawaran? I'm just thinking you might be able to offer some insight.
Yeah, thank you. I was going to mention that actually the health data that will come out and the reports that are coming out would be a great thing to use. So if people are living nearby in any of those local authority areas, it's definitely worth looking at, and it's definitely worth pushing. your local authority, or if you work in those areas, to push in those local authorities to put in a clean air zone. Even without the government support, they'd have to be working on their carbon reduction going forward, because everybody has to be. West Yorkshire signed up to becoming net zero by 2038. That's West Yorkshire Combined Authority, and that to me implied all of the West Yorkshire authorities. So that would be an avenue or a way of getting or improving their carbon emissions. But I mean, Bradford providing those health data just is fantastic for other people to use that to prove that it works and shows the benefits of it. We're not talking about just money, we're talking about people's lives, people's health, and a healthier community, a healthier group of people in any city got to be worth fighting for. Thank you.
Thank you, Aaron. Salah, should we go to you?
Hi, Sepida. Hi. It's been really interesting to see all the data and everything coming out of this. I just had a small question following on from the other person who was asking about age data. We're doing a systematic review looking at inequalities in kind of air pollution interventions, and this looks like one that could potentially fit in, particularly given what you're saying about more detailed analyses underway. I assume that includes things like socioeconomic status and ethnicity. It would be really useful to see those when they come out. Is it at all possible to kind of link up with you so you make sure that we have this to include?
Absolutely, Sepida. If you want to email me, and I'll link you in with the team at Born in Bradford that are doing the research, and make sure you get first access to it.
That's great. Thank you.
Please go ahead, Emma.
Thank you. You mentioned obviously, Sally, that there's a huge amount of income that the council's getting and that it's ring-fenced, and gave the example of the schools project. But again, just sort of thinking about kind of next steps, is there any thoughts about, you know, other projects? So for example, I'm thinking, we know there's quite a big link of respiratory health and our learning disability patients at the Care Trust. So if we were going to do it, or if there was any opportunity to do any sort of campaign, or I don't know, anything practical that might support that cohort of the community, that would be really welcomed, I think, as well as sort of obviously some of the age and you know, focus on children. So yeah, just thinking about any kind of next steps for some of the projects.
Please do link up with us on that, Emma. Give us a shout. We're doing quite a lot out in communities anyway, but anything that would be tailored to work for you guys, would love to work with you on it. We've got an air quality roadshow and go out into communities. We're obviously not just dealing with traffic pollution. We deal with industrial pollution. We talk about wood burning stoves. We get involved in all the planning applications. We're looking at the council fleet. We deal with a lot of policy issues as well in the air quality team. So the clean air zone is one tranche of what we're doing. It's a big one, but it's not the only thing we're doing. So please do link up with us. We can discuss things we could do together there.
Yeah, that'd be good, because the main location that we see those patients is on Queen's Road, right, which obviously it has got better, but it's just always bugged me that a location that we take people who are particularly vulnerable to air pollution is one of the worst.
Yeah, you're right. That is one of our worst places. One of the three worst spots on Manningham and Queen's Road. Yeah.
Yeah. Okay.
You're right.
Okay. I'll email you separately. Thanks, Sally.
Great. Thanks, Emma. Robert.
Hi there, Sally. No, just wanted to jump in. Obviously, at the teaching hospitals in Bradford, we're you know, keen to get involved in this as well. Born in Bradford, very much based on our site, aren't they? At Bradford Teaching, well, BRI. We've been looking at a travel plan, and I've started to make inways in what that plan might look like. We've done the staff travel survey. I want to do a patient visitor one this year as well. I've already started to explore how we might link this into the work that's really going on through Born in Bradford. Just in December, I delivered a training session to our board, just looking at how we might integrate some strategic thinking in our sustainability ambitions. So the idea of, Health on the High Street came up as well. I've got a conversation probably tomorrow with our Health on the High Street lead looking at how they might tie into our travel plan, and just as Emma says there, that community link as well. So as the conversation develops, I mean, I'd love to join a kind of another follow-up conversation just to see how we could really make our travel plan impactful, and how it could tie into the community work.
I think through our climate action planning and sustainability work, we are really keen to pull together a board with some key staff that talks around things and partners with yourselves. And so send your details over, Robert, and we'll keep you informed on that. I think Emma as well would be interested to hear about that. So yeah. Sharon.
Hi, Sally. Other than raising awareness on wood burning stoves, are they in your area? And if they're in your area, how do you monitor them? If you're out of the area, are you just awareness raising, or have you got something else up your sleeve?
So the wood burning stoves is an interesting issue in that it's quite often in different places to where the clean air zone is. It's not a traffic issue. It tends to be in the more affluent areas off the grid, off the gas grid. So it might be sort of Ilkley or Bingley, those kind of places, Silsden, different areas. So what we've done is tried to target those places to sort of talk to them about. There's a clean air night that happens every year, and we go quite big on publicity there in those kind of areas. We put out a radio, a piece on radio. We've done billboards and what have you, and we've gone out into those communities with our roadshow to talk to them about the problems that it can cause, not just for you neighbours, but for yourself inside the home as well. And indoor air pollution itself is a big issue that we go and talk to communities about. A lot of cooking goes on that causes people issues that they don't think about. So yeah, it's not just inside the clean air zone. Does that answer your question? Is that?
It does. I was just thinking how it landed, and it is often in our more leafy suburbs, but I was just wondering how it landed with people, and did you have anything other than awareness raising?
The confusing thing around it is it's not that long ago people were told to burn wood to help the climate as well. So it's that same way they were told to drive diesel cars, with some quite difficult issues there to unpick for people, and it's getting the understanding right. But I think most people, when they realise that wood burning stoves cost you more, the other thing is we've put some monitoring out, some little nice pieces of kit in these leafy suburbs, and what we're seeing is these high peaks Sunday afternoons. That's not traffic. We know that's wood burning, and we're starting to see some really good evidence that there is quite a lot people are getting exposed to out there. It's just sharing that with people. There's no point monitoring it if we don't tell them. So there is legislation around it. We're working with Wakefield Council to look at the way that they're dealing with that. And there are some things to simplify dealing with smoke nuisance and what have you that we're looking at. But just at the moment, it's mainly been a communication campaign rather than a punitive one. Any more questions?
Can I just mention, I've just put the Clean Air Zone, Clean Air Day website link onto the chat function. There's 40 people in the room just now. If you want to do something that's coming up, it's on the 18th of June 2026. You don't have to start from scratch. The website gives you stacks of artwork, stacks of flyers, posters, information, links, video clips, whatever you need to do something, anything you want to do. If nothing else, print out one of the posters and stick it on your, I don't know, if you go into the office, stick it in your office or ask your local shopkeeper to put it up. There's just so much information available, and I feel like we're all discussing it today, so it'd be really good if people can either connect with other people in the room now or connect with other colleagues when they're back in their off MS Teams now, and do something. And I'm sure, Bradford will have loads of stuff as well on their website. So it'd be great to know that something has come off more than, I mean, it's so easy to sit through a lunch and learn session and think, right, I need to do something. But of course, the day job is still there waiting for you to log off and do all your emails and everything else.
Just to say, the council go pretty big on Clean Air Day. We tend to do a big event where we bring in a load of school children and do some really nice workshops and what have you with them. And we go around the different schools and get different kids in each year. So we're more than happy to share what we're doing.
And Emma, you mentioned about learning disabilities. If there is something we can do for, maybe instigate it for the Clean Air Day, we're, happy to help out where we can. And there's enough of us from in and around Bradford to be able to do something.
Emma? You're on mute, Emma.
Sorry. Yeah, it's probably not a question for you, Sally, but maybe some of the public health colleagues on the session might be able to help. Thinking about indoor air quality, and in particular sort of vapes and things. And we've had in our inpatient wards, and in some areas they are allowed to vape on the ward, and we've had some reports from staff feeling a bit unwell, and sort of claims that it's as a result of the of being sort of around people that are vaping. But obviously there's not a lot of research, not a lot of information, and we haven't got good quality enough indoor air quality monitors to be able to regularly monitor to then say, okay, it's high in this particular area, and potentially see that there's some sort of causation and stuff. So I just wondered if anybody's aware of any work in that area, and as we kind of clean up the outdoor air and people then have windows open and have windows closed, then they have a tight box of dirtier indoor air as a result of various things, including vapes. Yeah,
Emma,
what are people doing about it?
We've been working on a project called Ingenious. My colleague Liz, I think she's on the call. If I can link you two up, there's been a lot of work in that space that we've been doing in Bradford, in homes, and other locations. So there's a lot of research now there that we've got and data. So if I put you two in touch, is that okay?
Brilliant, thank you.
Ralph's got his hand up.
Yeah, speaking my role at Oasis Manningham, firstly on the vapes, can I say that's a really good link? As the father of a lung surgeon, we've got a lot of issues with vapes and young people, but I was going to look at the issues around getting teenagers and the age range we've got engaged in this, because can we link this to resistance to using public transport? The beginning and the end of the day here, we're in the top third of worst air pollution, I think, at Lister Park. We're along the corridor that all the pollution hangs in, but there's a huge amount of people who do not, we've got one child who cycles, and there's a huge number who could use buses but do not seem to want to or be used to using or do feel comfortable. So if we can link with WICA on trying to get that, because we've got people revving for about an hour at either end, it's more at the end of the day, but at the beginning, I mean, literally, I know the wardens are coming out and doing what they can, but until we can get people looking at other ways of getting from A to B, it's going to be a bit of a problem. And as a Saltaire resident, can I tell you, the air in Saltaire is now worse than it was in inner city Manningham. Every Friday evening, about 7:30, you're coughing on your doorstep because all the wood burners are kicking in. Right.
Thanks, Ralph. I think, yeah, more comments, but yeah, I agree. My colleague Liz is on the call, and I know she wanted to sort of float an idea to you all. Liz, do you mind just talking about the idea of alerts and issues that we could talk to these guys about?
Yeah, no problem, that's fine. So something we've thought about doing at the council in the past is having some kind of air pollution episode alert that could go out to people when air pollution is going to be particularly bad due to weather conditions. Now we have to be really careful with alerts, because a lot of the issue in Bradford is the underlying day-to-day levels of pollution, the chronic effect of those, and that's there all the time. It doesn't go away. So what you don't want to do is alarm people every day about the air pollution, because we're working on that to improve it. What we're talking about here are those particular days in the year where you get weather conditions that cause inversions, for example, in winter, or in summer we get a lot of photochemical smog happening. And we quite often see it's at times when you get information on like the news in the evening, there'll be a pollution alert, and you'll know yourselves that only happens kind of a handful of times per year. So it's really to address that particular issue, to give those people that are really, really sensitive to air pollution, will have acute symptoms as a result of that, some warning to let them know that, you know, they maybe need to change their behaviour or just stay indoors or not exercise excessively when this is happening. We've not been able to do it in the past because to be able to predict air pollution requires some form of forecasting in terms of modelling, etc., which the council's not chosen to put resources to in the past, because better to solve the problem than to predict the problem. However, the government has just launched a brand new dashboard for the public, which puts together all the air pollution data that's been reported to them up and down the country. We've been asking for this for years and it's finally arrived. Hallelujah. But as part of that, what's quite interesting is they have introduced a forecasting part of that as well. So as a council, we now have on tap a free forecasting resource. So the next logical step for us is now to take that forecasting and to then sort of get that out to public information. Now, obviously, we can do stuff through the council. We've got social media and that kind of thing that we can use for that. But we felt it'd be much more kind of better to come from the health sector, in terms of, you know, you're probably already giving people alerts about lots of other health issues, or giving them advice and texts and things that we're not really fully aware of. We've all got relatives and things that have had sort of various information through from the NHS about various issues. But it was this whole issue of, could we have a wider conversation about what methods do you use at the moment to reach particular sectors of the community who might be at high risk? You know, those people that have had heart attacks, those people that have got asthma, those people that have got small children, those people that are elderly, you know, so we could actually get something direct to their personal text if possible. I mean, other councils do have like sign-up alert systems, which then means the council's got to handle lots and lots of personal data, so it then becomes a huge, massive problem for us to set up the project. But if you already have those systems in place, and you've already got those databases and they're all controlled, etc., the ideal from our point of view will be for us to notify somebody in NHS who would then click the button and send out the alert to all the people that are already on their alert systems. So it was just to put that on the table, really, and see whether there's any appetite to help out and do that.
I wonder if we can, if it's possible, and I'm looking at or thinking about my NHS colleagues, if it's possible to maybe just look at one cohort of, you know, service users and start with just the one cohort, either COPD patients under a consultant or respiratory, you know, patients who are regular users of the service, something like that, but find something quite small to get that initial, you know, group signed up, and then think about expanding it based on that. It might be worth all of us going away and thinking about it and thinking, you know, identifying one group.
Yeah, I think that sounds really sensible, Hara. And if we could run like a pilot project, so if somebody could put the hand up to be the pilot, you know, we're geared up already at this end to do the daily checks. We've got marketing communications staff that are able to send the information on. So really, we're looking for a partner to work with, and that sounds like an ideal idea. I don't know if David wants to say some more on it, maybe.
Yeah, I'm interested in getting involved with that. We've done similar things before for point of care testing. So we've worked with GPs who have then pushed out messages on their SMS systems. We're also looking at a national smoking cessation program as well, where we're working with secondary care, hopefully, to use their systems to then push out messages. So I'm sure you can do a similar approach with air pollution.
That sounds great, David. Maybe we could have a conversation outside this meeting, maybe about the best way to pick that up. That'd be excellent.
Yeah, we get involved with projects and help run projects. We haven't got the technology. We're not within the NHS, our own organisation, but we're here to support, you know, NHS and industry. So I think I'm aware of a couple of I don't know if they're wearables as well, which do that and alert you when it's like for asthma, particularly for asthma, when you've got patients who have got quite severe conditions and they're trying to be forewarned of pollution. So I can have a quick look as well, see if there's anything personally which could be linked to with that as well, with the SMS.
It's great. Thank you, David.
Thanks, David. And what I've put in the chat is just that if anyone needs linking up with people, I mean, people are welcome to put their own emails in the chat and link up that way, but just if you email Sally, her email's in the chat, and then she can sort of coordinate that, if that's okay, Sally.
That's fine. Great.
I'm aware of time because we've gone over a little bit. Howard, should I just hand over to you to just wrap up?
Yeah, sure. I just wanted, Jill, you've mentioned your comment. Do you want to quickly mention what you've said on the chat? Or are you okay with what you've said on the chat function? Right, I don't, yeah. Okay. All right. Thank you all for joining us. And thank you for being here and participating and asking lots of questions. Following on from here, we will send out the slides and the recording of this session. And I think Sophie's just mentioned, if you please reach out if you'd like to either get involved, do something, or just find out more. And one of us will respond as appropriate. And again, thank you so much for being here, and look forward to bumping into you all sometimes in the near future. All the best. Have a good week, I think.
Bye, everyone. Thank you.
Thank you.